Today's lesson is going to be in childhood trauma and depression. So I'm going to go over a research question, a thesis statement, and I'm going to go over 2 articles. I do include 3, but you can just check the third one out for yourself, but it won't be on any test. So our research question says, how does childhood trauma affect depression? What kind of treatments is there for depression? And then the thesis statement would be, psychotherapy like cognitive therapy is effective in the treatment of depression that's been caused by childhood trauma. And then so some arguments for the topic is there's a connection between childhood trauma and depression. And then the second one would be children who face childhood trauma and depression have treatment options. Okay, so for our first one, it's Journal 1. And Journal 1 talks about the different trauma a child can face in their life. The journal talks about studies that have been done that show the effects of childhood trauma, and the article also goes into about PTSD about children and trauma, and it talks about PTSD and MDD as well. So our first case study, the study shows that about 79 people were chosen for the study. The study was done at the Federal University of San Pablo, and the study patients who faced PTSD and mental disorders caused by trauma were studied. And then they used different instruments like the clinical administered PTSD scale, back depression inventory, and early trauma inventory to test their PTSD and see how it affects them. And then, so a quote from the study would be exposure to extreme life stressors in the prepubescent period, such as loss of parents or sexual or physical abuse, has related to an increased risk for depression and suicide. So a little bit of an explanation about that. The quote shows different traumas that children could face in their lifetime. The traumas have been shown to increase a person getting depression, and life stressors, especially young children, have a negative impact on their life, which can lead to depression. How this relates back to my thesis is because it shows the types of childhood trauma and it connects it back to depression. So for our second journal, the second journal focuses on how adolescents deal with depression. It gives statistics of Americans facing depression. In the case study, it checks out different therapies on, it tests out different effects of therapies on adolescents with the depression. And the therapy, it gives them different cognitive skills to learn and mixed with other different treatment types. So in the second case study from Journal 2, the study was done in 13 clinicals in the United States, and it was done in 4 stages. And stage 1 was 12 weeks of treatment that involved medication. Stage 2 is 6 weeks of maintenance therapy, and stage 3 is 18 weeks long, which the patient starts cognitive therapy. Stage 4 is that follow-up treatment for each patient. And the end results was that a combination of medication and therapy will help decrease depression faster for a student. And then psychotherapy itself can also decrease depression in the long term, but it does take longer than just including it with the medication. So a quote would be, therapy sessions were structured to include check-in, homework review, agenda setting, cognitive, behavioral skills, learning practice, and doing homework planning. And so the explanation, the case study in the journal talked about what type of therapy children would be receiving. This is a layout what normal therapy sessions would look like for children who have depression and childhood trauma. This relates back to the thesis because it shows that what the treatments would look like for children who had depression and anxiety. And it's given an example of how children were treated for depression and when they had it. So I also have a third one. So this kind of connects both things, but you won't need to know this, but I'll just go through it. So you just want to look at it. And then here's another quote. And here's an explanation as well. And then there's more explanations. Here's another quote. And there's more explanations. But we won't really need to know this on the test. But I also have a synthesis of all of the research I've done as well, but we don't really need to know all of this for our test, just the things I've read out to you guys. And then here's the bibliography of everything. So this gives all my sources. So if you want to take a look at this, I will leave it posted for you guys, but just everything I did read out to you is what's going to be on our test. Thank you guys.